the Senate Public Health and Welfare Committee is called to order. We have a couple hearings today, House Bill 2259 and Senate Bill 531. And is Dr. Kimberly Swan online or present? No, okay. Give us just 1 second while we recalculate our plans. Okay, so what we're going to do is we're going to swap the hearings. We're going to go ahead and open up the hearing on Senate Bill 531, enacting the Massage Therapist Licensure Act. And with the Revisor's Office to give us a bill overview is Jenna Moyer.
Good morning, committee. Thank you. Mr. Chairman, this is Jenna Moyer in the Revisor's Statutes Office, and this is a briefing on Senate Bill 531, which would enact the Massage Therapist Licensure Act. Section 1 of the bill just gives the bill the name. Section 2 goes over relevant definitions. And Section 3, which begins sort of toward the middle to end of page 2, would require and set out the requirements to obtain licensure as a massage therapist. And those would be obtaining a high school diploma or equivalent, that the applicant is 18 years of age or older, has no disqualifying conduct, is a citizen or legal permanent resident, and successful completion of a course of instruction that's approved by the board. And that board would be the State Board of Healing Arts. And it would require at least 625 classroom hours of supervised instruction and the successful completion of a nationally recognized competency evaluation in massage therapy. And Section 4 would be what's colloquially referred to as a grandfathering period. So it would allow individuals prior to July 1, 2023 to be issued a license if they meet the requirements, this lesser amount of requirements, and have already been in practice for at least 3 years and have been an active member of a professional massage or body work therapy association for at least 12 months. Section 5 would allow the board to issue a license to a massage therapist license in another district, such as another state, the District or Columbia, or another country, if the board is of the opinion that such person is qualified. Section 6 states that nothing in the act should be construed to regulate professions that are not massage therapy, including things like athletic training, acupuncture, chiropractic, cosmetology, dentistry, social work, veterinary medicine, or any other profession licensed by the state of Kansas. And nothing in the act shall be construed to prohibit massage therapy when a person is employed by the United States government, when such person is duly licensed in another state and is only in this state to teach a course or to consult with another massage therapist, if they are a student enrolled in school, or if they are, or if such person, is doing this as part of a charitable organization. Additionally, Section 7 sets out the requirements for an individual licensed, that such person would use the letters LMT to identify this person as being appropriately licensed. And on and after September 1st, 2024, it would be unlawful for any person who is not a licensed massage therapist to engage in massage therapy. Any violation of this would be a Class B person misdemeanor. And additionally, it goes through some of the disciplinary requirements. Section 8 sets out the advisory committee, which would have 6 members, 2 board members, and 4 non-board members that would be established to advise and assist the board in implementing this act. And 2 members of the board would be appointed by the board, and 3 of the board members would be massage therapists appointed by the board who would also be required to be residents of the state. And then not more than one board member would be required to own a massage school. Section 9 sets out the licensure fees, and just the normal licensure fee would be capped at $75 per year. And Section 10 goes over continuing education, and then there would be certain convictions that if a person were to have been convicted of, it would be disqualifying, which is pretty boilerplate for regulated licensure. And there's a little bit more, but I think that gets the gist of it, and I'll be happy to answer any specific questions if there's something I didn't cover.
Committee, questions for Jenna? Not seeing any. Jenna, oops, I do see one waving now. Senator Stephan.
Thank you. Ms. Jenna, on page 5, lines 32 and 33, says you can't hold yourself out as a licensed massage therapist. Can you hold yourself out to be a massage therapist? Or does then the practice of massage therapy preclude any activity that involves such behavior?
So if you read the line before, it would say, on and after September 1st, 2024, it would be unlawful for an individual who is not licensed as a massage therapist to hold oneself out as a licensed massage therapist or to engage in the practice of massage therapy. So if you're engaging in the practice of massage therapy, it would be prohibited. But if you are doing massage therapy as part of, let's say you are a physical therapist and that's part of your practice, that would not be obviously prohibited.
Thank you. Then on page 1, line 24, the end of that sentence where it says for therapeutic purposes. Is there, what if it's not for therapeutic purposes?
Mr. Chairman, I'm not exactly sure what you're referring to.
It says massages for therapeutic purposes. So massage therapy, if it's not for therapeutic purposes, it's not massage therapy. Yeah, if you're not holding out that you're doing it for therapeutic purposes, then you really aren't practicing massage therapy. Is that fair? Is that from a legal standpoint?
Thank you, Mr. Chair. I guess I'm having a hard time understanding what other purposes it would be for. I mean, paragraph 1, this says the things that it doesn't include, like therapeutic exercise, the diagnosis of injury, chiropractic, physical therapy, electrical stimulation. I guess if there's something that I'm not understanding.
They put the qualifiers on there that is specifically only for therapeutic purposes. So, that's a very clear identifier. Or if that wasn't intended or needed, it wouldn't be there. And you could just end the sentence before, after pressure of soft tissue. I'm just trying to figure out how encompassing this is. Is this going to totally end the novice massage therapist of any sort? Is everything become illegal?
That is a great question, and hopefully some of the conferees can go a little bit more into those specific questions about what this has been, what the intentions behind creating the bill were. And I should note for the record that this is a mirror, or very close to a mirror of House Bill 2400, which was introduced last year, and the only change would be to update everything, pushing it forward 1 year. And that bill was referred to Health and Human Services, and it did not receive a hearing.
Okay, committee, I do not see any more questions for Jenna. Jenna, thank you very much. Committee, we'll now turn our attention to proponent testimony. Our first conferee is Dr. Joan Duvet, State Health Officer for KDHE.
Not for this bill.
Yeah, we're on 531. How about Christine Hauber, Chief Government Relations for NMTA on behalf of James Becker?
Hi, I'm Christine Huber with the American Massage Therapy Association. Good morning. I'd like to thank the Senate Committee on Public Health and Welfare for allowing me to speak on behalf of the American Massage Therapy Association, also known as the AMTA, in support of Senate Bill 531. AMTA represents more than 95,000 massage therapists nationwide, with 396 members in the great state of Kansas. AMTA is the largest nonprofit professional association serving massage therapists, massage students, and massage schools. Established in 1943, AMTA works to advance the profession through ethics and standards, the promotion of fair and consistent licensing of massage therapists in all states, and public education on massage therapy health benefits. Kansas is currently one of 3 states with no form of licensing or regulation for the practice of massage therapy. Statewide licensure of massage therapy is crucial in setting baseline entry-level requirements, establishing a scope of practice, as well as protecting the health, safety, and welfare of my fellow Kansas residents. In lieu of a state license, some cities and municipalities in Kansas require a local massage license for practitioners. This model becomes expensive and overly burdensome for legitimate massage therapists. A statewide license would offer protection for both the public as well as educated and well-trained massage therapists. Licensure would also address massage therapists who have had their license revoked in another state or have a conviction relevant to the practice of massage therapy. By providing a legal definition that creates a scope of practice for the field of massage therapy, professional licensure helps consumers identify the responsibilities and services unique to a massage therapist. A scope of practice allows consumers to select the most appropriate massage therapy professional for their needs and brings the benefit of open access to the selection process. Licensure establishes a consistent standard of practice, which is enforceable by a professional code of ethics and creates a formal grievance process for consumers that helps prevent unethical and/or non-compliant massage therapists from continuing to practice. Massage therapy has a growing presence within the U.S. healthcare system. Massage therapy has been singled out as an effective non-pharmacologic approach to pain management, as shown by a significant body of clinical research and supported by the National Institutes of Health, the American College of Physicians, the American Academy of Family Medicine and the Joint Commission, the Mayo Clinic, MD Anderson Cancer Center, Duke Integrative Medicine, the Cleveland Clinic, and Memorial Sloan Kettering Cancer Center, along with other institutions. Additionally, the Centers for Medicare and Medicaid Services has recommended in their plan benefit guidance therapeutic massage provided by state licensed massage therapists to be a supplemental benefit within Medicare Advantage plans. Under the current system, Kansans are deprived of choice as Medicare Advantage plans can only reimburse for massage therapy provided by a state licensed massage therapist. The Department of Defense and the Department of Veterans Affairs include massage therapy in their pain management guidelines, and massage therapy is a covered service in DoD VA facilities. The VA has established GS5 through GS9 positions for state licensed massage therapists. And because there is currently not a state license, our brave Kansas veterans are unable to take advantage of this benefit in VA facilities. AMTA is deeply grateful for this opportunity to speak on this and for your consideration of the bill. I'm happy to answer any questions.
Christine, thank you for your testimony. Committee, this is the only proponent oral testimony that we have. We do have 2 written only. So questions for the proponent? Senator Gossage.
Thank you, Mr. Chair. Thank you for being here. Can you tell me in other states, or does it vary, if I were a massage therapist and I would come under the American Massage Therapy Association, or do I join the association?
You join the association. We're not the only one. I believe one of the other major associations sent a letter in support, but it's a choice to join and use our liability insurance.
So I see structural integration practitioner and I see massage therapist as the 2 other proponents. Could they maybe be neutral?
Structural integrators are included usually in the bill in exemptions, and we have a coalition with other body workers. So usually they're in support because they don't hold themselves out to be massage therapists.
So if someone wanted to become a massage therapist, what type of monetary investment would they have to make?
It really varies state to state. For that, let's say licensing passes 625 hours, most schools would actually provide more than that. Rough numbers, education can be anywhere from, 8,000 to 15,000 for a couple-year program, and I'm just throwing out estimates. But that's pretty standard across the country. It takes about a year, maybe longer, depending on the program to complete.
And who offers this education, this 625 hours?
There are currently, I think, 4 schools in the state of Kansas. I know one out in Hayes, a couple in the Kansas City area. Usually some are career colleges, some are independent. It's kind of a little bit of everything.
Thank you. Thank you, Mr. Chair.
Senator Petty.
Thank you, Mr. Chairman, and thanks for being here. You mentioned in your beginning about the number of members in the state of Kansas you already have. Did you say what that number was again?
It's 396 as of a few days ago.
Okay, and so these members have an annual membership in your organization, and if they're does their membership imply that they have gone through this kind of training?
Yes. So we provide liability insurance, and so our members have to meet a minimum threshold of hours and education, so it can't be just anyone who waltzes in and says they're a massage therapist.
So I have had massages, but I have to say I have neglected to pay any attention to. So if I had had a massage from someone that was a member of your organization, what would they have on display right now? Most good, massage therapists would have their certificate of completion from the school they went to. Some would have, a certificate from us proving that they hold liability insurance and that they're a member. But those would be the only probably 2 things they could have up in lieu of having. Now, if they were in a city like where I live in Prairie Village or Overland Park, that city requires a local license, so they would probably have that up. Okay, and lastly, we're one of only 3 states that do not have something in legislation licensing massage therapists. Thank you.
Senator Baumgartner.
Thank you very much, Mr. Chair. Thank you for being here today for your testimony. I'm assuming that hopefully you looked at the neutral and opponent testimony, but one thing that we do know is that massage spas and the massage industry is the second leading industry for sex trafficking. So there is concern that there is not adequate guardrails to protect with regard to prostitution and sex trafficking. So I was curious, the other states that do have this licensing, do they have some kind of guidelines in their legislation?
That specifically addresses human trafficking? Not typically, but what we do find is that with that state license, it becomes easier to identify the legitimate massage practitioners versus, those fraudulent entities holding themselves out, besmirching the good name of massage therapy for nefarious purposes. And we have seen in other states, law enforcement have a good relationship with the massage board. So when there's those complaints that come in, or if someone calls and says, hey, I think this spa is not legit, they can work together to make sure that those places are, A, held accountable, and B, don't hold a license.
Okay, and one final question, Mr. Chair. It seems that more often it's massage therapists, if you will, I'll use that in quotations, where they actually own multiple spas. And so address that licensing for individuals that would be working at or owning multiple spas?
Well, the licensing language as currently written would just license the individual. We do have some states that will do establishment licensing as well, and that would be something that would then keep track of, multiple locations. But, and this language would not preclude cities from still regulating what goes on in their borders. So they can have certain requirements for businesses, in addition to the state license. So the board wouldn't necessarily be keeping track of separate locations.
Okay, thank you, Mr. Chair.
Senator Stefan.
Thank you, thank you.
You were going to be the first one.
Tell me a little bit more about the training facilities. Are they private businesses? What are the?
The schools?
Yeah.
There are some private schools. There are some associated, I guess I think the one out in Hayes is associated with the college out there. So there'll sometimes be like an auxiliary program related to a junior college. There's not really any one model. Most of them go through, an accreditation, so incoming students can know that they're getting quality education. Anyone else?
Senator O'Shea.
Thank you, Mr. Chair. I was listening online, minus going through the parking garage. But my question is, very often a doctor or physical therapist will suggest that you see massage, but insurance doesn't cover it. So would this in any way begin to help insurance start to cover those services?
Yes. I mean, not immediately, but it is something that we have been working on. And we're currently in the process of having massage covered through Medicare and Medicaid, and we've had good luck in West Virginia, North Carolina, we're working on Washington State right now. So, the first step is getting that state license, but it's recommended in CMS guidelines, and that's the first step, and then private insurance would be the step after that. But that's the long game, right? I mean, insurance covers acupuncture and chiropractors, and massage therapy is, a great alternative for pain management.
Okay, committee, that does conclude our questions, it looks like. So, Christine, thank you very much for your testimony. We do not have any oral neutral testimony, but we do have 2 written. So now we'll go to opponent testimony. Our first conferee is Ed Klump. Ed, welcome to the committee.
Thank you, Mr. Chairman and committee members. I am Ed Klump. I'm here representing the Kansas Association of Chiefs of Police, Kansas Sheriff's Association, and Kansas Peace Officers Association. Our interest in this bill is purely what has been alluded to by Senator Baumgardner and I think maybe by Senator Stephan. And that is not what we are sitting here thinking about with the good therapists that are providing good services for medical reasons. Our issue is with these massage parlors, facilities that engage in activity that includes human trafficking and primarily sex trafficking. And our concern with this bill is that it doesn't include some provisions we think is very necessary for us to address that issue, but it includes a preemption that prevents us and does away with the local regulations that we have in place today to address those. And there are numerous communities across the state that have those in place. So if you look at section 13, page 11, lines 9 through 19 is a preemption clause, and it prohibits cities and counties from having regulations regarding the licensed therapist. And depending on how narrow the scope of the bill is, it either doesn't address the problem therapist community, or so it's out there in limbo yet, or it does include them, and then we have a lack of information that we can use in our investigations. So what our members have told us is the key to their success in these has been their local regulations that allows them direct and immediate access to the information on the applications from the therapists. And the law enforcement agencies are usually the ones engaged in the investigation on those applications to make sure they're legitimate services. So what we see in human trafficking in the massage industry is generally a very mobile therapist community, and they don't stay long in one place. We see other signs of not only the sex trafficking, but oftentimes there is also the labor trafficking involved in it. So we're very concerned about that preemption clause. We also note that Section 4 has a grandfathering clause in it, and in that it has, I think there was 4 things listed on page 2, lines 36 through 40 that has to be met. And then it has a list of things that you only have to meet one of those. And one of those is that a requirement in lieu of 3 years of experience. So if you have 3 years of experience, you wouldn't have to be subject to the other requirements. Well, you know, for the illicit massage problem, you could have 3 years of experience. It doesn't even have to be in this bill. It doesn't even have to be in the United States or in the state of Kansas. And so there's no way to validate what is that experience, what's that defined as. So we think that's very problematic. It doesn't appear this bill, and from the proponent's testimony, I think it was clear it wasn't any intent to do the business licensing. We feel very strongly that business licensing should be left to the local entities. But in this bill, even though it doesn't intend to address the business licensing, we find a provision in Section 13 addressing the preemption, saying that doesn't apply to zoning requirements. Well, we don't zone people, we zone businesses. So it tends to allude to businesses. And then also it provides that local law enforcement may inspect business premises. So there's kind of a mix there, and that troubles us a little bit. One of the big gaps in the bill on the preemption is there is no specific date the preemption goes into effect. So that would go into effect immediately upon passage of the bill. However, if you look on page 5, line 25, the licensing provision doesn't go into effect till September 1st, 2024. So we have a gap in time when our local regulations couldn't be in effect, and nothing's happening on the state level yet. And the other thing we would point out is on page 8, line 39, where it talks about rejection of the license. It is a may reject. We believe things should be split into 2 categories: things that must cause a rejection, that are certain rejection things, disqualifiers, and then certain things that the board can consider and use for rejection. That's similar to what we do with alcohol and other regulatory functions. Mr. Chairman, I'll stand for questions.
Thank you for your testimony. Committee, we do have other opponents, and Ed, I know you have another thing. Okay. We will hold questions until all opponents have had an opportunity to testify. Committee, our next opponent is John Goodyear, General Counsel for the League of Kansas Municipalities. John, welcome to the committee.
Thank you, Mr. Chairman. Good morning, committee. My name is John Goodyear, and I'm the General Counsel for the League of Kansas Municipalities. And grateful for the opportunity to come in and to give testimony today in opposition to Senate Bill 531. And Mr. Klump did a great job of highlighting the reasons for which we oppose the bill as well. We don't have a position as to whether or not the state should enact a licensing program for massage therapists. Our opposition to the bill stems solely from the preemption in Section 13 of the bill. When cities utilize home rule authority to pass ordinances regulating these businesses, they are developing a local solution to a local problem. Some cities have stepped in, passed ordinances that regulate or license these businesses because they found these regulation schemes, these licensure provisions, helpful in preventing and monitoring crime. If this bill passes, cities would be prohibited from passing or maintaining these regulations that have been helpful in protecting a community. And as the proponent said, Kansas is one of only 3 states that hasn't come in and licensed these. And in that lack of licensure and that lack of regulation, cities have stepped up to the plate and started monitoring these businesses to help protect their community. Cities should retain that ability to regulate these businesses as they see that it is needed. So, Mr. Chairman, I don't mean to belabor the point, so the League is opposed to the preemptions in Section 13 of the bill and would ask that the committee consider removing those if you plan to move the legislation forward. And I'll stand for questions.
John, thank you very much.
Thank you.
Committee, our last opponent testimony is John Luth, Deputy State Director of Americans for Prosperity. The first John's name was spelled with an H. This John's name is spelled without the H, in case you were wondering.
Easy to differentiate us that way. Thank you, Mr. Chairman, members of the committee. My name is John Luth, Deputy State Director with Americans for Prosperity. Thank you for the opportunity to be here today. I think the other two conferees did a fantastic job, so I will try to be very quick here. From 1993 to 2012, Kansas added nearly 30 new occupational licenses to those occupancies that rank within the low and moderate income professions. On top of costing the state of Kansas nearly 30,000 jobs, this licensing has also cost the average Kansan in a few different ways. For example, we've seen Kansas reach price inflation of 27% for licensed services. And then this occurring obviously causes those services to be, that cost to be passed on to those consumers. So now, consumers in Kansans that are just trying to get that massage are having to pay for these additional licenses, additional fees, and anything else that may come up when we see these licenses occur within these professions. We have heard at times that these things are about health and safety. I would just like to point out that if it were not for the numerous studies linked in my written testimony, but as well, such as one from the Institute for Justice License to Work report that have repeatedly shown that this type of licensing has a negligible impact on health and safety. In fact, in 2016, the Vermont Secretary of State's Office of Professional Regulation reviewed this very issue and reviewed all research, or a lot of research concerning massage therapy and licensing. One of the studies that they reviewed from the Journal of Bodywork and Movement found that there was no evidence suggesting any safety difference between states with and states without licenses for massage therapists. And upon conclusion of their review of all of the research, the Vermont Secretary actually published the conclusion that research tends to strongly suggest massage therapy is a safe profession. The data is there, the data has been studied and restudied, and the facts are that instituting yet another occupational license on massage therapists will serve only to drive up costs and erect new barriers to opportunity as we continue to shatter the lower rungs of the economic ladder. We cannot do that to Kansans. We cannot afford to do that, as we know, as it has been mentioned in this committee before, as Kansas continues to rank in the top 10 in the country for outward migration, we need to give Kansans an opportunity. This very situation is being well managed, as we've heard today, at a local level. It should continue to be well managed at a local level. And in Kansas, we should be seeking to break down barriers to opportunity. This bill would do exactly that, opposite of that. So I ask you to oppose this bill, and happy to stand for questions.
John, thank you for your testimony. Committee, we are now open for questions on the opponents. Do we have any questions? Senator Steffen.
Thank you. This is for the John without the H.
See how handy that little bit of knowledge comes in?
It really was, and I have no doubt I'll remember it. It's really a request. Could you email me a link to 2 or 3 of your best studies that you were quoting from?
Yes, sir.
Thank you.
Senator Petty.
Thank you. And this is a question for Ed.
Yes.
Hi, Ed. Thanks for being here. So you, since we are one of only 3 states that do not license massage therapists, I know one of the proponents that was written testimony mentioned that not being licensed could be a contributor to attracting sex trafficking through massage therapy. because all of our surrounding states are licensed. Thoughts on that?
Sure. And my name is Ed Klump. I'm here for the 3 law enforcement associations I mentioned earlier. That is why we have local regulations, because we do see value in that licensing where we have these problems. Those are mostly around the metropolitan areas, but they exist in all areas of Kansas to some degree. So if there's no licensing, that is a problem. But what we have today is licensing that's been developed in the local areas, in cities and counties, working with the legitimate massage therapists in a way that we can identify those problem areas and address them. And through the licensing process is where we make contact with those businesses, we make contact with the therapists wanting to be licensed, and it gives us that opportunity to have that time with them, and through that we've identified oftentimes the suspicious activities leading to investigations on human trafficking in those areas. So we don't advocate for no licensing. We advocate that we need licensing. In fact, we could live with state licensing, but we have to have an information exchange. We have to have that ability to have that same information we access today through our local licensing process. And we want very desperately to absolutely retain the business licensing aspect of this.
Just as a follow-up, so I followed through on section 13. I didn't quite understand it does say, nothing in the Massage Therapy Licensure Act shall affect local zoning requirements. You're talking about every municipality, which often I hear up here is, we don't want to have this, we want to have continuity, but that every municipality should have their own ability to have their own licensing requirements for this industry.
For the businesses, yes. And we have worked with this industry in the past. This isn't a new bill. This has been around for several years. We worked with them in the past trying to develop ways that, we could do a state licensing for the therapist. We recognize there are some advantages to that. But when it's not done in a way that allows the information sharing with law enforcement and it cuts us out of that process, then we lose all the advantages we have with our local current regulations for those communities that have those.
For those communities that have those.
Right.
Because not every community has regulations, I'm going to assume, for massage therapy.
That is correct. I think it's safe to assume that those communities where we've had these issues with the illicit massage therapists and policies or businesses develop those regulations so they can address those issues.
And lastly, could you provide us examples of other states that have multiple licensing requirements, both at the local level and at the state level?
I don't have that information. I suppose I could research that. It's a little difficult for me to access all the state laws. But I want to be clear, you keep talking about multiple licensing. We're not asking to maintain local licensing of the therapists if there's going to be state licensing. What we're asking for is the ability to locally license the business because those are in fixed locations, and so we don't have that issue of multiple licenses. This bill doesn't intend to address that, but it breaches into things dealing with the businesses themselves, which causes us concern. But if there's going to be state licensing for therapists, it needs to be complete. It needs to cover the type of activity that is often frequented in those illicit businesses, and it needs to be an inclusive process with local authorities, and we need to have access to the information of the state licensing applications and things like that. And those are what's absent in this. There's a lot of work needs to be done to join those together, and that's why we're opposing the bill.
Thank you, Ed.
Okay, committee, it doesn't look like we have any further questions for opponents. If I haven't already told you, we do have 2 written-only opponent testimonies. This will conclude our hearing on Senate Bill 531. So we will now close our hearing on Senate Bill 531 and open the hearing on House Bill 2259. And here to give us the bill overview with the Revisor's Office is Jenna Moyer.
Thank you, Mr. Chair. Good morning, committee. House Bill 2259 excuse me, would allow the use of expedited partner therapy for certain sexually transmitted diseases. And I will note that this was amended by the House Committee, and it passed on a vote of 75 to 49. Section 1 defines relevant terms in the bill. The first of those that I'm going to go over would be a healthcare provider, which would include essentially physicians, APRNs, and physician's assistants. And a sexually transmitted disease would be any disease, of course, spread through sexual contact, defined by rules and regs that are in that list of reportable infectious diseases under KSA 118, and they would be established in, or they are established in the administrative rules and regs under KAR 2812, and they would be required to be designated for expedited partner therapy by the secretary. And just based upon what other states have done and what's recommended by national organizations, it would likely be gonorrhea and chlamydia. And this bill would allow a healthcare provider who diagnoses a patient with one of those sexually transmitted diseases to provide expedited partner therapy if that healthcare provider, in their professional judgment, believes that the partner's sexual partner is unlikely or unable to come to get examined, tested, and treated. A healthcare provider who chooses to provide this partner therapy would be required to provide counseling, including the distribution of a pamphlet and materials that would be developed by KDHE. And subsection D sets out the requirements to be included in that literature, including a warning to pregnant women, information about the specific drugs and the dosages, information about treating and preventing sexually transmitted diseases, requirement to abstain from sexual contact until a certain period passes in order to prevent infecting other partners, the importance of testing, and the risks to those partners if these infections were not treated. And a healthcare provider who uses this expedited partner therapy will only be allowed to if that exposure occurred in the last 60 days. The House amendment is on page 2, beginning in paragraph 4, and it would allow an individual who's 16 years of age or older to consent to receive expedited partner therapy when no parent or guardian is immediately available. Subsection C is the liability provision is the liability and disciplinary action provisions, to where a healthcare provider or pharmacist would not be liable if they were to practice expedited partner therapy in good faith compliance with the provisions of this section. And this would not include, of course, things like gross negligence or willful or wanton misconduct, and would also not subject that healthcare provider to disciplinary action by the State Board of Healing Arts, the Board of Nursing, or the Board of Pharmacy as is applicable. And the only other thing would be to, the secretary would be required to adopt rules and regulations to administer and implement the section, which would almost certainly include the diseases that could be treated by expedited partner therapy. And I'll be happy to answer any questions.
Thank you, Jenna. My question I do have a question, and it deals with the House amendment. What was their reasoning and thought process for putting that in? Paragraph 4, page 2.
Yes, I'll have to look back into my notes because this passed out of the committee last year, but I know that there was discussion whether or not a teenager who came in would be allowed to receive treatment under this. And so I believe it was just clarifying, because 16 years of age would be the age of consent for sexual contact in the state of Kansas, that an individual who's that age or older would be allowed to consent to receive that therapy, even if their parents weren't present. There's a similar provision I will note. I believe it's for just general treatment by a physician that would allow an individual who's 16 years of age or older to consent to such treatment. I believe that would also include things like for vaccinations, that if you're 16 years of age or older, you can consent to medical treatment.
Okay, thank you. Committee, any further questions? Okay. Senator Erickson.
Thank you, Mr. Chair. And Jenna, thank you for that. I'm just trying to comprehend this in a practical sense. So someone goes in to their physician, they're diagnosed with, what's the STD? What do they call it now? Okay.
I mean, that's what it's in the bill, as a sexually transmitted disease.
Okay.
One that could be treated by something where the risks would outweigh the benefits, a generic antibiotic. So this would be most likely for bacterial STDs, not for viral STDs.
Okay. And so then I get that diagnosis. I know I've had 3 partners. And so I tell my doctor, I need prescriptions to treat the 3 people I've been with within the last 60 days, and I'm able to obtain those prescriptions. Am I understanding this correctly? And then I take those and then go to my partners and say, here you, I mean, and is that the process, the practicality of what this bill does?
Thank you, Mr. Chair. Senator Erickson, this would allow a healthcare provider to provide expedited partner therapy, which would be to prescribe, administer, dispense, or otherwise provide antimicrobial drugs to a sexual partner of a patient. So you could, in my understanding, would be either you could give the prescription, the physical one, or send it to a pharmacy to be picked up.
Follow up, if I may, Mr. Chair. Is there any other diagnosis of anything where the patient says, gee, I may have infected a number of other people, give me prescriptions for them? The flu, the common cold, anything. Is there any other area that we allow this type of practice to occur?
Thank you, Mr. Chair. Senator Erickson. Not to my knowledge in Kansas statutes, but I will note that this is not a new concept. There are several other states that have similar expedited partner therapy provisions in their statutes.
Thank you, Mr. Chair. What could possibly go wrong? Thank you.
Committee, seeing no further questions. Jenna, thank you for your explanation and answering our questions. Moving to proponent testimony, is Dr. Kimberly Swan online yet? Okay. Dr. Swan, welcome to the committee.
Oh, thank you. Can you hear me?
Yes.
Okay, thank you. And I'm sorry I joined a little late. I appreciate the opportunity to speak to you today. My name is Kimberly Swan. I am a practicing OBGYN in actually Overland Park, Kansas. I run a residency program, and so I deal with a number of the patients that are affected by this policy. And I am here also on behalf as the chair of the Kansas section of OBGYNs. So this bill is something we are really interested in seeing passed. We would be the 46th state to pass it. So this has been actually approved by the CDC for a number of years, I think since 2006, and practiced in a number of our neighboring states. The concept is that patients that come in with gonorrhea, chlamydia, and a lot of times trichomonas will come in and we'll treat them, and then they will get reinfected by their partners. And so we're trying to prevent that reinfection, and primarily in OB patients, and the patients who come in, especially around chlamydia, they'll come in, they'll be infected, we'll treat them. We always retest them about 4 weeks later. And if they're still positive, we have to keep treating them. And typically it's probably reinfection. And this can cause a significant problem for babies, as it can cause a conjunctivitis or a pneumonia for babies that are born in a woman that has positive chlamydia. Also, untreated gonorrhea and chlamydia is really common in men. Men don't have symptoms, so they frequently will be, unfortunately vectors because they don't get treated. And women are the ones who suffer the consequences because they'll develop pelvic inflammatory disease that can lead to lifelong infertility. So this is a well-established practice. It has been in practice for a number of years in a number of states. It would be a huge benefit for our patient population, especially for our female patient population who tend to bear the burden of this disease process, as well as our newborns. And I stand ready to answer any questions regarding this, and appreciate your consideration of this topic. This is something near and dear to our heart, and something we'd really like to see as an option so that we can continue to provide the appropriate care for our patients.
Dr. Swan, thank you for your testimony, and I believe we do have one other proponent, oral, so if you could hold on for questions,
Sure.
we'll hold until Dr. Joan Duvay, the State Health Officer, is going to give us her proponent testimony. So.
Oh, thank you very much, Chairman Hildebrand, members of the committee. My name is Dr. Joan Duvey. Almost got it right, rhymes with groovy. And I serve, it's my honor to serve as the State Health Officer for the Kansas Department of Health and Environment. Thank you for the opportunity to provide supporting testimony relative to House Bill 2259. We strongly support this bill in the use of expedited partner therapy, which for short we call EPT, for the treatment of sexually transmitted infections. Prior to the SARS-CoV-2 pandemic, the most common reportable infection each year in Kansas has been the sexually transmitted infection chlamydia. During calendar year 2019, 15,283 cases of chlamydia were diagnosed in Kansas, with 98% of those occurring in people of reproductive age. Left untreated, as we heard, chlamydia can result in infertility, ectopic pregnancy, pelvic inflammatory disease, and in rare circumstances, life-threatening sepsis. One of the most significant risk factors for these complications is repeat infection, and most repeat infections are due to re-exposure by an untreated partner. The use of EPT removes barriers to ensuring the prompt treatment of potentially infected partners and thereby reduces the risk of reinfection. Nearly 70% of all chlamydia cases in Kansas are diagnosed in women because women are more likely to seek out preventive health services such as screening and have symptoms of infection. Men, by contrast, are less likely to have routine screening or to exhibit symptoms of infection. EPT provides an option for providers, and I want to underscore the word option, to treat the partners of infected individuals who are unlikely to seek medical care by asking the individual with the infection to deliver a prescription or medication directly to their partners without requiring a medical visit. Data shows us that the more barriers to care that can be removed, the more likely it is that patients will obtain the care they need to treat sexually transmitted infections like chlamydia. And I'll add here that in Washington state, they actually showed that levels in the population of chlamydia decreased with EPT. EPT is supported at the national level by numerous organizations, most notably the Centers for Disease Control and Prevention, as well as professional organizations of medical practitioners. In addition, it's currently supported in 46 states, including in our neighboring states of Missouri, Colorado, Nebraska, and Arkansas. The medications recommended by the CDC for treating chlamydia are safe oral antibiotics with few side effects or contraindications. EPT has been in common use in most states for more than a decade, with no major adverse events reported, further demonstrating the safety and efficacy of the treatment. There's been some economic modeling published by the CDC describing the lifetime cost of $46 for each male chlamydia infection and $262 for female chlamydia infections. And if you look at the price of generic medications online, a single dose of azithromycin is less than $10. With the chlamydia infection burden in the Kansas healthcare system, we've calculated an estimated lifetime cost of $3 million in 2019 alone, just for this one disease. Given that chlamydia infections have increased by 32.4% between 2015 and 2019, these avoidable medical costs can be reasonably expected to increase by more than $150,000 each year, where the trend of increase continues.
Dr. Duvey, I apologize. I just looked at the clock and we are
Sure.
out of time.
Okay.
And committee will take one quick question. Senator Erickson.
Thank you, Mr. Chair. Quickly, I do have two quick yes, no.
Okay.
Is it possible for a partner to test negative even though their partner who went to the doctor tested positive?
I I suppose that would be possible, but it's unlikely.
Okay, so I may not even have it, but I'm going to get a prescription for it. My second question is, when I Google this issue, there's a question on there. How do I treat my partner for chlamydia without them knowing? Do I have a right to know if I've been exposed to an STD? Thank you, Mr.
Well,
Chair.
there is no possible way to treat them without them knowing.
Follow up, Mr. Chair, if I may. If my partner goes to the doctor and gets a prescription for me, sure, they can treat me without me knowing it.
They could give you the medication.
Without my not, is that a possibility?
That they would give it to you and not tell you what it was for. I imagine it could happen. We can't, there's no way we can know what conversations occur. That we are required to provide information, including information that is supposed to be given to the partner. So we are doing our due diligence to make sure that that information is shared.
But without you seeing that patient directly, you don't know that they're receiving that information. You don't know if they're being treated properly. You don't know if they even know that they're being given medication for it. Okay, thank you, Mr. Chair.
Committee, and thank you to our conferees. We are out of time and a little bit over time. We do have minutes to approve. If we can do that in the next 30 seconds, did everybody have an opportunity to read and review them? Have a motion by Senator Baumgardner, second by Gossage. All those in favor say aye. Aye. Those opposed, no. The minutes are approved. And committee, we are adjourned. Thank you.